what is the burden of influenza in older adults?
Yes, thank you. So I can see these slides. I'm going to come this way. Well, influenza A is associated with a more significant burden of illness in our older adults. And by older adults, we really define people aged 65 and over. This is where we see the majority of hospitalizations and actually deaths in this age. The AH3 and 2 particularly has a great impact on our adult population because they suffer from comorbidities, respiratory diseases, coronary heart disease, diabetes, and so on. And what we also see is the level of circulation of the influenza A virus is linked to all-cause mortality we see when it's in excess and also hospitalizations. Now, the influenza attributable pneumonia and influenza hospitalization, as well as deterioration of respiratory and circulatory conditions, end up with hospitalization of our patients. And that is actually greatest at times when the H3 and 2 is actually dominating in our communities. Now, influenza B has a greater effect and spreads more easily and affects more children. On the other hand, we actually see worse outcomes and deaths among our adult patients. Now, age-related decline in the immune system is a matter of fact. We cannot avoid it. And as we get older, we don't respond so well to the infection as well as the vaccines we give our patients. Around the world, every year, we have about 1 billion cases of influenza. We have about 3 to 5 million severe cases with severe disability, with admissions to hospital because of pneumonia, of cardiovascular, respiratory problems, and others. And of course, this rising disability that requires treatment also can lead to greater use of antibiotics and therefore more of a chance to actually develop antibiotic resistance in our communities. Healthy people deteriorate, and people who are ill with chronic disease also can deteriorate. They may need to actually be admitted to hospital or in the intensive care unit, and generally, quality of life actually is reduced and their independence. About 250,000 to 500,000 people will lose their lives around the world every year because of influenza directly. And of course, we see excess mortality among very severely ill patients when they get influenza. And these are patients with problems like diabetes, coronary heart disease, respiratory disease, and so on. As a family doctor, when I see patients with community-acquired pneumonia, I really exercise my brain. What is the cause of this problem I'm seeing in my community? And in fact, influenza is the second most common cause of community-acquired pneumonia in primary care in the UK. Now, what about major causes of death? Very recently, about a month or two ago, we had data released for 2015. And as you can see, in males, influenza and pneumonia is the 6th most common cause of death. And in women, it's even worse. It's actually in the 4th place. So we really need to do something about this disease. And we try and vaccinate as many people as we can, and we should achieve really high vaccination rates. And as you can see, many countries achieve that, but we can see also year-on-year reduction in our vaccination rate with the arrow pointing downwards. On the left, you can actually see that we have got countries with quite high immunization rates. In Middle Europe, we have medium results. On the right-hand side, in the east, we have low or very low immunization rates. We really need to do better. If we are a unified Europe, we need to have unified results. And back to the UK, you can see here the cumulative influenza confirmed hospital admissions by age group and influenza type. And what the data actually refer to the season just we finished. That's week 40 from 2016 to week 14, 2017. And it's so evident that as regards to the elderly, the 65s and over, H3N2 is the most dominant strain they actually get. Yes, we had quite a lot of influenza A that is as subtype. We have a bit of B, we've got a bit of H1N1, but H3N2, that is the big problem for our elderly.